Hi, so today our topic is respiratory or oxidative burst. So, respiratory burst is the rapid production of ROS. ROS are reactive oxygen species. So, respiratory burst is the production of ROS by neutrophils and macrophages after phagocytosis of a microbe, and it is used to kill the engulfed pathogens inside the phagolysosome, right? So if this is your neutrophil and this is a bacteria, so your neutrophil will engulf it and take it inside, and it will form some kind of vacuole that is known as a phagolysosome, right? So this is your bacteria inside the phagolysosome, and this is where it will be eliminated by the process of respiratory burst. So, reactive oxygen species are highly toxic molecules that are used for microbial killing, and it is an oxygen dependent process, right? So, it uses oxygen and it is very effective in eliminating microbes. So, what happens? First of all, oxygen is taken. So, this is molecular oxygen. Oxygen is taken and converted into a superoxide anion, right, or an oxygen radical, and this is done via the enzyme that is known as NADPH oxidase, and this is a very important enzyme and very high yield. Okay, so just remember the name. Now this superoxide anion is then taken and then converted into hydrogen peroxide, and this is done by the enzyme superoxide dismutase. All right, and then hydrogen peroxide is taken and converted into what is known as hypochlorous acid, or HOCl, right? And this is done by the addition of chlorine, and this is done by the enzyme that is known as myeloperoxidase, or MPO. Now NADPH oxidase is used to convert molecular oxygen into an oxide radical, and then oxide radical is converted into hydrogen peroxide by superoxide dismutase, and then hydrogen peroxide is converted into hypochlorous acid by the enzyme MPO, or myeloperoxidase, and then this halide radical, right, or HOCl, is then used to kill the bacteria or the pathogen, and this is a very effective manner of killing pathogens. Now, like I said, NADPH oxidase is a very high yield enzyme in this pathway. The reason being because deficiency of this enzyme is seen in a disease that is known as chronic granulomatous disease, right? And I will talk about this later on. But what you have to know is that in this disease, NADPH oxidase is deficient. That means you cannot convert your oxygen into hydrogen peroxide or into hypochlorous acid, and basically you won't be effectively killing your bacteria, right? So that is one of the problems that we see. And in the same manner, there's also an enzyme deficiency disease, right, which is known as myeloperoxidase deficiency, where you cannot form your hypochlorous acid, again meaning that you cannot kill your bacteria as effectively. Another point that you have to know is that this first part uses NADPH, right? So NADPH is used, and this NADPH is formed in the HMP shunt by the enzyme glucose 6-phosphate dehydrogenase. This is just a side fact that I think you need to know, but this is what's high yield, right? So NADPH oxidase and myeloperoxidase, these both enzymes are really high yield in this pathway. Now, what happens in chronic granulomatous disease, right? So what happens is that since you cannot form these oxide radicals or hypochlorous acid to effectively kill the bacteria, then obviously you will be more susceptible to infections, right? So what happens is that it's not much of an issue earlier on. The reason being because some bacteria or some pathogens, they form hydrogen peroxide as a metabolic byproduct. So what your neutrophils or macrophages do is that they use the pathogen's hydrogen peroxide, right? They use their hydrogen peroxide and they use it to form hypochlorous acid, and then they use it to kill the bacteria itself. Basically, they bypass this whole first two steps. They jump directly onto the second last step. But what if you are infected by a catalase positive organism? Now that's an issue. The reason being because catalase is an enzyme, right? Catalase is an enzyme that basically degrades hydrogen peroxide. It degrades it into water and oxygen. So catalase positive organisms can infect these patients more, right? Why? Because they degrade their own hydrogen peroxide, and because they degrade their own hydrogen peroxide, the neutrophils cannot snatch it and use it to make hypochlorous acid, and that means that you cannot kill that bacteria. So main point is that in patients with chronic granulomatous disease, they have an increased risk of being infected with catalase positive organisms, and I'm going to talk about this in detail later on. Alright, so chronic granulomatous disease is an X-linked recessive disorder, meaning it affects males more. It's an X-linked recessive disorder of deficiency of NADPH oxidase, right? It decreases reactive oxygen species production and it impairs the O2 dependent killing. There is an increased susceptibility to catalase positive organisms because they can degrade their hydrogen peroxide. So a few examples of catalase positive organisms which are high yield are going to be your Staph aureus, E. coli, Listeria, and Candida, Aspergillus, right? So there are many more, also Pseudomonas. So there are many more, but you have to remember that they have an increased risk of being infected with catalase positive organisms. And this leads to prolonged inflammation and formation of granulomas. Why the formation of granulomas? Because your neutrophils, since they cannot kill it, what they do is that they try to wall it off, right? So that's why they form these granulomas, to basically wall off or try or maintain or basically contain the infection. All right, so how do we diagnose this disease? Basically, there are two tests done. The first one is nitroblue tetrazolium test, and in this disease there's a failure of the color turning into blue, right? And the other test is dihydrorhodamine test, and in this there's a failure of the color turning to green. If you have these both tests negative, that means you have chronic granulomatous disease. Next is myeloperoxidase deficiency. This is an autosomal recessive disorder where you have a deficiency of myeloperoxidase. Myeloperoxidase, if you remember, is the last step of converting hydrogen peroxide into hypochlorous acid, right? So in this disorder, there's an impaired halide radical formation, right? Now this is a relatively milder condition and it is mostly asymptomatic, but the patient may present with recurrent candidal infection. Since it's an MPO deficiency, your nitroblue tetrazolium test and your dihydrorhodamine test are both normal, right? Because these both tests are done to check for decreased NADPH oxidase.